Now we'll look at arthrofibrosis. Now we'll look at arthrofibrosis. Okay, so for the arthrofibrosis, we're trying to discuss what is arthrofibrosis and how it could actually affect you. So let me just give you guys a summary of what arthrofibrosis is. Anytime you hear arthro, it simply means you are dealing with the joints. Of course, fibrosis is the presence of fibrous tissues. You understand? So it's just like that. Okay, arthrofibrosis. So it's just a condition where excess scar tissue forms inside or around the joint. So it leads to a stiff, leads to pain, leads to restricted range of motion. So it's most commonly studied at the knee. So anytime you see pictures of arthrofibrosis, 80% of times you always see the knee. But this is just to let you know that, yeah, you could also find it in other joints. Do you understand? Like the shoulder, like the hip, like the ankle, like the elbow, like the wrist. You can also find it, you know. So you have fibrous tissue. So fibrous tissue, you have fibrous tissue. So inside your joint, see, look at this. This space is supposed to be empty for synovial fluid to be there. You get? But before you know, these tissues are actually clogging the areas that synovial fluid is supposed to be there, and it leads to a lot of stiffness and pain in your joints. So causes, it could be that they did a surgery for you, so this is like a complication of surgery. It could be as a result of trauma or injuries to the point. It could be due to prolonged immobilization after surgeries or injuries. It could be due to inflammations, and sometimes it could arise without an obvious cause, like a frozen shoulder. So symptoms is a lot of pain and stiffness. There's reduced range of motion, and the place is swelling. There's warmth, and there's crepitus. That's like if you try to move the joint, there's no creep sound like that, you know. Limping or difficulties with daily activity. So in severe cases, there's now abnormal positioning of the patella. So diagnosis, you do clinical examination where you're measuring the active and passive range of motion. Then also MRI to now visualize scar tissues and rule out any other cause, you know. Okay, so treatment approach is conservative is the first line. Okay, then all those anti-inflammatory medications, you know, target physical therapies where they are now doing all those kind of small, you know, exercises. So avoid aggressive exercise. Just be moving, just to maintain the range of motion at that side. So other surgeries that could be done is we have the manipulation under anesthesia. We are breaking the adhesions by moving the joint while the patient is anesthetized. We have arthroscopic lysis of operation of adhesions. Okay, so we use arthroscope to kind of like put in the joint and cut the adhesions. And also we have the open surgeries.